Hello everyone, my name is Dr. Anand, your Pediatrics faculty. This is a short, quick segment where I'm going to tell you the most important pictures and videos and topics which can come in exam and which you should must revise before the main paper. Starting number one with the milestones. So sitting with support comes by 6 months and sitting without support comes by 8 months. And we all know that baby knows his full name, age and sex by 3 years and a baby can go to toilet alone by 4 years. The next segment we have is growth and development. One very important question, weight doubles by how many months? So weight doubles by 5 months and triples by 1 year, and height doubles by 4 years and triples by 12 years. Next important segment came in INICT paper also regarding the head circumference. The next topic, what is the normal head circumference of a newborn? Around 35 centimeter. How does it increases? The beginning 3 months of life, it increases by 2 centimeter per month. Next 3 months, 1 centimeter per month, and next 6 months, 0.5 centimeter per month. Coming to syndromes, most favorite topic for all the exams. If I say single palmar crease, what will you think of? The answer is Down syndrome. And which is the most common congenital heart in Down syndrome? It is endocardial cushion defect, which is also known as AV canal defect. Next question, female patient with a webbed neck, what will you think of? The answer is Turner syndrome. And the most common congenital heart in Turner is a bicuspid aortic valve. Next question, image based, male patient with a webbed neck, what will you think of? The answer is Noonan syndrome, and the most common congenital heart in Noonan syndrome is pulmonary stenosis. Next image based question, where do you see butterfly shaped vertebra? The answer is Allegany syndrome, and the most common congenital heart in Allegany is pulmonary stenosis. Next important point, you should know infant of diabetic mother. A lot of questions on infant of diabetic mother. Which is the most common congenital heart in infant of diabetic mother? The answer is VSD, and the most specific is TGA. Now let's have back to back 10 questions on cardiology. 10 x-rays top class. Number one, where do you see boot shape heart? So boot shape heart you see in tetralogy of Fallot. Where do you see box shape heart? The answer is Epstein anomaly. Where do you see figure of 3 appearance? The answer is coarctation of aorta. And where do you see figure of 8 appearance? The answer is supracardiac TAPVC. White-out lung, image-based X-ray. Where do you see white-out lung? The cardiology condition for white-out lung is infracardiac TAPVC, and the respiratory condition for white-out lung is nothing but hyaline membrane disease. Neonatology, top-class question. What is the treatment of choice of neonatal jaundice? The answer is phototherapy. Yes, the machine, the image in front of you, phototherapy. What is the wavelength of this machine? 450 to 490 nanometer. And very importantly, what is the side effect of this machine? The answer is bronze baby syndrome. If I ask you a question, a newborn baby, he has got a trauma on the head, and that is because of prolonged labor. So prolonged labor having a swelling on the head, prolonged labor, the answer is caput succedaneum. If the baby has a traumatic delivery, forceps delivery, and then having a swelling over the head, the answer is cephal hematoma. Next question, GIT, diarrhea. Which is the most commonest cause of diarrhea? The answer is rotavirus. How much is potassium in ORS? Very regular question. The picture in front of you, ORS packet. How much is potassium? Potassium is 20, sodium is 75, glucose is 75, citrate is 10, and chloride is 65. Next question, what is Risomal? Risomal is rehydration solution for the malnourished. Last 3 questions, then this class is over. Infectious disease. If I ask you a question, image based, where do you see Koplik spots? The answer is measles. Next question, what is the pathophysiological, I would say microbiology finding of the measles? The answer is Warthin-Finkelday giant cells. Last to last question, if I ask you maculopapular pustular rash, maculopapular pustular rash with an erythematous base in neonatology chapter, the answer is erythema toxicum. And last question, image based, 5-year-old boy came with complaints of bilateral cheek swelling. What will you think of? The answer is mumps, and the most common complication of mumps is aseptic meningitis and orchitis. So thank you so much everyone. That was all about the rapid revision, and remember, successful is the one who enjoys his daily routine. Thank you.